It is important to understand the potential and evolving role of proton radiation therapy for treating certain cancers over the more traditional photon radiation therapy. An important challenge is to identify and understand the cancer disease states that may be particularly suitable for and benefit from proton radiation therapy.
As with other forms of external beam radiation therapy, proton therapy is delivered in a non-invasive fashion using an external robotic device that moves around a patient. The location that the proton therapy beam terminates within the body can be controlled with a high degree of precision, making it ideal for tumors adjacent to critical healthy organs.
Before beginning the simulation, insert the extended tabletop into the treatment table and ensure that it is locked. Place an inflated immobilization cushion over the tabletop and the indexing bar for the leg mold at the level of the patient's knee. Place a solid headrest at the top of the table and confirm that the patient has completed the full bladder process by drinking 16 to 24 ounces of fluid 45 minutes prior to the scheduled scan time. After registering the patient into the computed tomography or CT patient registration system, select the prostate scanning protocol with a slice thickness of 3 mm. Ask the patient to sit on the table and assist the patient into a supine head-first position. Place the patient's legs into the inflated immobilization cushion so that the mold will envelop the side of the legs and create a barrier between the legs, and position the patient's arms on the chest. Confirm the patient alignment with the